Okay, start talking about our discipline. Semesters will study Propaedeutics to Internal Disease or Introduction to Therapy. Propaedeutics mean introductory course to therapy, primary course to therapy. Discipline, uh, talking about main methods of examination, symptoms of internal disease, and the main principles of their management. What is internal medicine? We talk about propaedeutics as introduction to internal medicine. What is the internal medicine? Internal medicine is the major branch of medical practice and research because internal diseases are the most common. Internal disease have the highest mortality rates as well. Therefore, study of internal disease is the leading subject of medical training. Again, in future years, you will study surgery, obstetrics and gynecology, ophthalmology, ENT disorders, and a lot of different subjects. But if we talk about amount of hours, total volume of discipline, basic and the biggest, this is internal medicine. Why? Because this is base of medicine. You may be in the future, I don't know, surgeon or ophthalmologist, but you can't be a doctor without good knowledge about internal medicine. Again, this is internal medicine, this is mathematics of medicine. 2 plus 2 equals 4. This is internal medicine. And actually, our discipline, because on senior courses, you will study faculty therapy or faculty internal medicine, then hospital therapy. No, actually, terms internal medicine and therapy, this is synonymous. So if we talk about internal disease, what is internal disease? If you have internal disease, we should have external disease. What is it? The term internal disease came into use in the 19th century to stand alongside with then popular term therapy. Again, I told you, internal medicine and therapy, this is the same. The development of new complicated methods of diagnosis and treatment requiring specialized skills and training on the part of the physicians has led to the formation of separate branches of medicine, such as cardiology, gastroenterology, endocrinology, hematology. But again, this is why one doctor can't know everything about all disorders. Knowledge is enormous in medicine. That's why we have different specializations, as we tell. But nevertheless, basic, this is internal medicine, internal disease. Therefore, despite a further separation of special branches, general medical training and education, and the integrating research into internal disease and related subjects are now even more important, because problem is, if you are a cardiologist, you shouldn't forget about endocrinology, pulmonology, nephrology. You can't be doctor only in very narrow subject. If you don't know other disciplines, you can't be a good doctor because you can miss other disorders. If you know only about the heart and you have patient with problem of lungs, and if you don't realize this is problems of lungs, not the problem of heart, you may make a very serious mistakes, and all mistakes in medicine may lead to patient death. So again, internal disease, this is one of the most important, or I may say the most important part of medical training. Now, a few words, how we divide disorders. We have internal disease. We may say that we have, for example, surgical disease. When we separate internal disease or therapy or surgery, we don't talk about disorders usually, because it's very difficult to separate disorders into therapy or surgery. For example, you have patient with peptic ulcer, very common disorder. And if this peptic ulcer uncomplicated, without complications. Okay, this is internal medicine. Gastroenterologist will treat this patient. But if something happens, for example, bleeding, peptic ulcer may have such complication as a bleeding. If patient with peptic has bleeding, of course, already this is not internal medicine. It is not. This is already surgery. Surgeon something to surgery or stop bleeding somehow. That's why again, in many cases, very difficult to separate these diseases, therapy or surgery, for example. But why we in this case have therapeutics or surgeons? This is not problem of disorders. This is problem of doctors. And that's why when we talk about internal disease, this is disorders which usually treated without surgery, using medications, for example. And again, main idea, division is not due to disorders. Division is due to doctors. Because, for example, if you are a therapeutic, you will never cut patients. You will never do some surgery. If you are a surgeon, no, you usually prefer to actually do surgery, but not to. But it does mean that surgeons can't prescribe medications, for example. So again, the main difference in internal disease or surgery, this is specialization of doctors. Specialization of doctors, because the same disorder may be at the same time surgical or therapeutic, depending on circumstances. No, on the other hand, if you have again COVID-19, of course, surgeons can do nothing with this. Usually, this is actually therapeutists treat such patients. But I mean, 19, we saw patients with pneumothorax, rupture of lungs, pneumocystis, and at the in pleural, in pericardium, and in this case, of course, we need help of surgeons, thoracic surgeons. Again, basically, this is division of doctors. Okay, you are going to be a doctor, doctors. What doctors do? What are the routine work of doctors? What for we need medicine? Or other question, what medicine usually do? Actually, we have three main branches of medicine. This is prophylaxis, this is or prevention, the prophylaxis or prevention. Next, this is diagnostic, and then this is treatment. If you have patient with some problem, you have patient with problem, you have ill patient, you have patient with some disease. What we should do with this patient? Why patient search for our help, for our care? Because we need to treat patients. But how do we know what we should treat? We should first find proper diagnosis, proper diagnose, to do diagnostics. Because if you don't know what have happened, if you don't know what disease, you can't prescribe proper treatment. And that's why doctors usually do two main things. This is diagnostics and treatment. And don't forget prophylaxis or prevention, because in many cases, it's much easier to prevent disease than to treat this disease. And so, no, we believe medicine should be prophylactic or preventive medicine should be. No, very simple example. No, you have, now we have outbreak or epidemic or pandemic of COVID-19. And you know that in many countries, prophylaxis started, the injections of vaccines started. And if you give vaccine to the patient, you prevent future development of disease. This is prophylaxis or prevention. Prevention may be not only giving some medications or vaccines. For example, if you don't smoke, you have very low chance to suffer from lung cancer. Patients who are smoking, they have 50 high chance to die from lung cancer compared with non-smokers. And that's why, what is the prevention of lung cancer? You just don't smoke. This is already prevention. And of course, Actually, in all countries, governments, they pay a lot of attention to prevention because, again, it's more effective prevent disease than to spend money for treatment of different disorders. Because medicine now very expensive. But nevertheless, usually in real life, you have a patient in your office and you should understand what to do with this patient, how you can know what to do. Find proper diagnose and then to prescribe proper treatment. Okay, we talk about diagnostics is the science of methods by which disease identified. So it means that diagnostics, this is identification of disease, identification of disease. And we should know methods how to do this. This is not very simple. No, it's the branch of medicine dealing with methods of the examination of patients in order to identify disease, determine the patient's condition, and prescribe the appropriate treatment and prophylaxis. So it means that to find diagnosis just means that you should name disease, understand what has happened. You should name disease. These patients suffer from COVID-19, and this patient suffer from flu, for example. If we talk about two main subjects of medicine, diagnostic and treatment, what is more difficult? No, I may say that diagnostics is more difficult. And even ancient doctors 2000 years ago know about this, and they told that we bene diagnose it, bene cure it. Doctor who is best in diagnosing, prescribe best treatment. Why? No, this is very difficult question. First of all, let's start talking about diagnostics, about diagnosis. I told you we should name disease. What is name disease? This is diagnosis. Diagnosis is a concise conclusion by the essence of the disease, the patient condition, expressed in terms of modern medical science. Modern medical science. So again, very simple. To find diagnose, this is to name the disease. Again, this is flu, this is COVID-19, this is peptic ulcer, this is actually, I don't know, myocardial infarction. How many disorders or diseases we know? You know, this is actually a special classification, international classification of disorders, international classification of disorders. Now we use 10 revised, actually 10 edition. And in this international classification of disease, we have about 20,000 disorders, 240 disorders, 20,000 disorders, enormous amount. Even name of disorders, this is 2 big books. Of course, no one can learn by heart all 20,000 disorders. It's impossible. No, fortunately, many of such disorders are very rare, and in your real life, you deal with few hundred of disorders usually. And many disorders you will never see during all your professional life. But nevertheless, just to imagine, 20,000 disorders, 20,000 disorders. And each disease has its own name. And you see, to find diagnose, it means that express in terms of modern medical science. All doctors in the classification of disease. For example, in different countries, sometimes name of disorders may be a little bit different. If in our country, I will tell that these patients suffer from Bazedov disease. Doctors in England, for example, they can't understand what happened with patients because they know that this disease has a name, Graves' disease. In Russia, Bazedov disease, in England, Graves' disease. But to avoid such misunderstanding, just use international classification. In international classification, this disease named diffuse toxic goiter. This is disorder of thyroid gland, diffuse toxic goiter. In Russian language, absolutely the same. Диффузный токсический зоб. Diffuse toxic goiter, diffusely toxicity zone. And in this classification of disorders, each disease has also its own characters and numbers. For example, J20.2. And every doctor in the whole world can open actually this textbook and find the J20.2. This is, for example, myocardial infarction. Okay, no diagnosis morbid, definition of the disease according to accepted classification. Again, in the whole world, doctors try to use the same classifications to name disorders. Classification of disorders. Few words about classification of disorders. Differentiate that. First of all, we need actually proper diagnosis. Why we have 20,000 disorders? Idea is very simple. Different disorders need treatment, usually. Usually different disorders need different treatment. The patient has fever, patient suffers from coughing, weakness, perspiration, and it may be flu, but it may be COVID-19. Why it's a big difference? Because treatment of flu and treatment of COVID-19 are no different, rarely different. And medications which can help in case of flu can't help in case of COVID-19. That's why, again, we need precise, proper diagnosis to prescribe proper treatment. If you fail in diagnosing, you fail in treatment. Approaches for classification of disorders. No, we use different approaches. Unfortunately, medicine is not like mathematics, where everything is very clear. We have formulas in mathematics, can calculate everything. Medicines, some people tell that medicine is not a science, because science is what we can describe with the help of mathematics. In medicine, mathematics is very difficult to use. Which approaches we use to classify disorders? Different approaches. Now, for example, we have infectious disease, for example, that big class of disorders, infectious disease. What does it mean, infectious disease? This is disease caused by some pathogen, germs, viruses, bacteria, parasites. And that, for example, TB, tuberculosis, this is disease caused by Kocher bacilla or Mycobacteria tuberculosis. Flu, this is disease caused by flu virus. COVID-19 caused by SARS-CoV-2, virus for COVID-19 known as SARS-CoV-2. Severe acute respiratory syndrome, SARS. No, this is good approach, because in this case, we know the cause, what caused the disease. And in this case, we talk about etiological approach, etiology of disease, the cause of disease. If we know cause of disease, we can prescribe treatment which can kill this virus or kill this germ and patient recover. You may say that in many cases, for example, HIV infection, we know the cause, but unfortunately, we still can't kill virus completely. But we have remedies now. These remedies can stop replication of virus, and patients with HIV infection now can live normal life actually for many, many years. So this is first approach, etiological. But unfortunately, for many disorders, we still don't know etiology, and that's why we can't use such approach to different disorders. Next group of disorders, for example, known as tumors. Tumor, cancer. What is tumors? Tumors, this is uncontrolled growth of some cells, which finally kill our body, organism. Tumors, this is etiology. No, we don't know etiology of many tumors still. No, we know some risk factors. I told you, for example, smoking increase risk for lung cancer, but we have still patients with lung cancer who never smoked, for example. So if we talk about oncology, if we talk about tumors, this is another approach. This is a pathological process. We know, for example, pathological process inflammation. We know pathological process cancer or tumor. And we can say that these patients suffer from tumor. Okay, this is another approach. Then in the same classification, you can find, for example, disorders of cardiovascular system, or disorders of gastrointestinal system, or disorders of blood. This is another approach. New approach, which system affected? If gastroenterological problem, gastrointestinal system, this is all about esophagus, stomach, intestine, liver, pancreas, all these organs. We believe this is gastrointestinal system. Another approach. That's why we use different approaches to classify disorders. No, it's not very good because no system, no mathematics. No, this is used in the whole world actually. And we should use this proper classification. In many cases, classifications mix, for example, to say tumors, to say nothing, because patient may have tumor of stomach. In this case, this is oncology from one side, this is tumor, on the other side is stomach, this is gastroenterology. Oncology patient with tumor. Okay, so this is few ideas about classification of disorders. Classification of disorders. Few words about disorders. No, I may ask you a very simple question. What does it mean disease? What does that mean disorder? On the first glance or first hand, it's very simple. No, what is disease? No, if someone suffers from disease, he is not healthy. We have health, then we have disease. Non-healthy means disordered. But another question, but what does it mean health? What does it mean absolutely healthy patient or absolutely healthy person? Do we have absolutely healthy persons in the world? It's a philosophical question because actually, you know, this is some joke among doctors, doctors joke that we don't have healthy people. We have misdiagnosed patients, meaning that if you examine precisely all people, you will find something, you will find some problem. That's why, if to say generally, disease is something what don't let patient to live normal life, something with foreign patient. For example, if you have pain, headache, you can't work. You have headache. So disease, first of all, don't let you do your jobs. Which jobs? First of all, occupational jobs, then social life, the daily activities. Again, disease, this is something which don't let you live normal life. Or disease is something which shorten your life because it was previously a healthy person doing sports, good, I don't know, teacher, everything was fine, but suddenly he experienced myocardial infarction and died in a few minutes. Previously, was everything okay? But again, sudden death, of course, we can't consider this is normal. This is disease because it's shortened patient life. This also disorders. Also, we use terms as disorders. This is something which don't let us adaptate to social, environmental factors, because all our life, this is adaptation to changing of everything, social, environment, weather, everything. And again, disorders usually don't let you adaptate proper way. No, again, this is more philosophical questions. What is it? Health, disease. Actually, you in your really daily activities, you will have definite patients, definite people. They visit your office and they ask your help. But you know that this is international statistics. About half of people who visit doctor, and present some complaints, really, they are absolutely healthy. They don't have disorders. They think that they have disease. They think that they are ill, but really they are not ill. But this is doctor should decide. This patient is ill, this patient is need care, or this patient need no care. And that's why this is a big challenge. Okay, let's start talking about diagnostics. What diagnostics include? Diagnostics include, first of all, the study of methods of observation and examination of the patient. The study of methods of observation and examination of the patient. Physical, laboratory instrumental methods, and this is medical or diagnostic technique. So first branch or first part of diagnostic, this is diagnostic technique. It means how to examine patient, how to search for signs of disorders, what we should do with the patient to understand what's happening. Of patient, when you ask patient about his complaints and ask patient about his history. So complaints and history, this is two most important case for proper diagnosis, because now young doctors believe that they have so many equipment, computer tomography, ultrasound examination, laboratory tests, that they need not even to talk with patients. Let's do all examinations and I understand what have happened. It's not true. In many cases, talking with patient, conversation with patient, patient's complaints, patient history, give you more than 90% of proper diagnosis. Again, you should talk with patient. And it seems that it's very simple. Okay, you have patient in your office and you ask, what have happened? Why you visit my office? Tell me about your problems. One patient reply, patient tell you, okay, doctor, I have abdominal pain. You ask, that's all? Patient, that's all. You write in your case history, abdominal pain. Is it enough to find proper diagnosis and to prescribe proper treatment? But it's not enough. What we should do in this case, to understand what have happened, of course, you should ask a lot of additional questions. No, your teachers will help you, but no, that's just think about what additional questions we may ask to understand what have happened with our patient. For example, patient tell you about abdominal pain. And first question, where? Localization. Patient, they don't know anatomy. Patients, they don't know what is epigastrial region, hypogastrial region, nasogastral region. He will never tell you that I have pain in epigastrial region. But you may ask your patient, please show me where is the pain. Show me where is the pain. And patient may show you localization of the pain. And for example, patient show you upper abdomen, epigastrial parts of the abdomen. And this is already give you some ideas, because diagnosing, this is such searching of one answer among 20,000 possible answers. We talk about 20,000 disorders. How to understand? This is very simple. We should throw away disorders which you believe can't happen in this definite case. For example, okay, you already know that this is not disease of brain, this is not disease of joints, this is not disease of lungs. No, about lungs, some exceptions, because medicine consists of exceptions. But nevertheless, abdomen, already, okay, this is already, we are thinking that this is something happens in abdomen. In abdomen, we have gastrointestinal organs. That's why we already know something wrong with gastroenterological system, GI system. Then, when you ask patient, please show me where is the pain. Patient show you upper abdomen, epigastrum. And you know already that what we can find in epigastrum. In epigastrum, we can find stomach, we can find pancreas, caput of pancreas, and sometimes pain from actually gallbladder also may be localized in upper abdomen. Again, one question, and you already believe, you can imagine which organs may suffer. The upper abdomen, it may be stomach, maybe pancreas, for example. If your patient suffer from pain in right lower part of abdomen, right inguinal area, you may expect it may be appendicitis, appendicitis. But again, remember I told you that medicine is all exceptions. Surgeons will tell you that in appendicitis, yes, appendicitis local inguinal area, but in some cases, in case of appendicitis, starts in epigastrum and then move right inguinal area, and this is even special sign. That's why already exceptions. That's why medicine is so difficult to understand. Okay, you ask your patient about localization of pain. Where is this pain? What else you may ask your patient? You may ask, okay, you have pain in upper abdomen, but this pain is continuous or periodical. So what does it mean? Continuous, it lasts for many hours, many days, sometimes without changes. Periodical, pain appear, disappear. Between attacks, patient feel nothing, periodical pain. You may ask about severity of pain. It's severe pain, very severe pain, slight pain, how you can characterize intensity of the pain. You may ask very important question if it's pain, if it's periodical pain. How often this pain happens? Once per day, 2 times per day, 20 times per day. Okay, you find that pain is periodical and happens few times per day. Next, very important question. What caused the pain? What do you do to cause the pain? Pain usually, this is signal that something wrong. And if we have some affected organ, what usually provoke the pain? Pain happens when we force to work. For example, if we have stomach problem, what may cause stomach pain? Force stomach to digest, to work. Of course, if it's diseased, if we have peptic ulcer in stomach, of course it may cause the pain. That's why very important question. What caused the pain? And for example, patient tell you, I have pain after meals. Very important. It means that meals, pain, it's gastrointestinal system. Next, it's not enough just to say what caused the pain. Very important question. How soon the pain happens after meals, for example? Why it's important? One patient suffer from pain, abdominal pain happens half an hour after meals. Second patient suffer from pain happens 2 hours after meals. What are the difference? Half an hour, 2 hours. Big difference. Between if pain happened 30 minutes or even less after meals, it means that problem happened where? In stomach. This is so-called early pain. But if pain happened 2 hours later, this is not stomach, because food usually stays in stomach about 2 hours. Then it shifts or move forward to duodenum. And again, if pain happened 2 hours after meals, it means that this is already duodenum. We already can imagine where is the problem, in stomach or in duodenum. If pain happened how long this pain lasts, seconds, minutes, hours. What do you do to stop the pain or to relieve the pain? Another important question, because we can understand mechanism of the pain in this case. For example, abdominal pain after meals, find natrium hydrocarbonates, soda, right? This is subject like a salt used to cook something. Natrium bicarbonate, natri 2CO3. What patient do? 1 teaspoon hot water, warm water, and drink. And after that, he feels himself better. Why? This is not remedy. This is just natrium hydrocarbonates. Why it helps? If you remember chemistry, what actually this natrium hydrocarbonates do with acid? Neutralize acid. Neutralize acid. And if patients suffer from peptic ulcer, you just imagine ulcer like a wound. What happened if you apply acid or spiritus to the wound? You feel pain. The same happened in stomach. In stomach, we have acid. If patients suffer from peptic ulcer, of course, acid irritates ulcer, causing pain. If patient take this natrium hydrocarbonates, acid neutralize and pain relief. Again, you ask this and you understand already what have happened. This is peptic ulcer. This is no other choice why soda or this natrium hydrocarbonates can help. You see how many additional questions you should ask to understand what have happened. But how do you know what mind? You should have clinical patients of all disorders. You should know that peptic ulcer is such set of complaints, and you should ask your patient about these complaints, about characteristics of these complaints. And if you succeed, if you find that what should be, you find in your patient, okay, this is correct diagnosis, this is actually proper diagnosis. And you see that actually you should ask a lot, you should talk a lot with your patient. This is complaints, What about history? Because complaints, this is what happened now with patient. History, this is what happened 1 year before, 10 years ago, 20 years ago. And if patients with abdominal pain tell you, you know, doctor, I suffer from peptic ulcer disease already 20 years. And from time to time, I have exacerbations which presented the same way. For you, it will be more clear that, okay, this is next exacerbation of peptic ulcer. This is history. We may ask patients about occupation, about family history, about his actually occupation. Some occupations can lead to occupational disorders. About his habits. You ask patients about smoking. If patient smoking, big chance that he suffer from lung cancer if he has some complaints from lungs. For dealing patients. Okay, you talk with patient and already you have some ideas. You have some diagnose, primary diagnose, so-called, in your mind. But of course, talking is not enough to find proper diagnosis. We also can use other methods of investigation. First of all, this is physical methods. Which physical methods? This is what you should examine using your eyes, nose, fingers, and this is what? First of all, just observation of patient. You see patient, and suddenly you understand that patient's skin has yellow color. A patient has yellow color of skin. This is not normal, okay? But you should know that this is not just yellow skin, that this is jaundice. Jaundice. And jaundice happens in case of rise of bilirubin level in blood. But you also know that we have different types of jaundice. We have parenchymal, obstructive, hemolytic jaundice. But nevertheless, this is jaundice. And you can find this using just your eyes. You see. In some cases, even face of patient, even behavior of patient can tell you a lot. We have specific phases for example, pyrotoxicosis or hyperthyroidism, for disorders of thyroid, gonadotropin hormone. In some cases, it's just enough to see patient and already you have in your mind proper diagnosis. For example, pyrotoxicosis, very specific phase, very specific behavior of the patient. Then you can use other, actually, your senses. Even smell. You have patient with smell of acetone. Smell of acetone means what? This is ketoacidosis. Ketoacidosis. And ketoacidosis, this is result of diabetic, usually severe diabetic patient, maybe even unconsciousness. Of course, not in all cases you can talk with patient. In some cases, patient in coma. In coma means that patient can't reply. But in this case, of course, you can use other methods of examination. For example, patient in coma, but you feel smell of acetone. Okay, immediately check his sugar level. It may be diabetic coma or ketoacidotic coma. Then we use so-called physical methods of examination. This is what? Palpation, percussion, auscultation. This is very simple methods, but nevertheless, these methods very important. Doctors can't live without this. You know, the problem is you can't send all patients. You may have 50 patients per day, and you can't send 50 patients to do computer tomography. Not enough computer tomography in the whole country to actually, if all patients will be sent, 15 patients for further investigation. You should separate patients. If patient has just a flu, what for he needs some examination by computer tomography, something like this. But if you expect COVID-19 pneumonia, in this case, you should send patient. But how do you know? Due to physical examination, complaints and physical examination. And again, we'll teach you how to do palpation, how to do percussion, how to do auscultation. This is skills. You know, it's important to learn skills by reading textbooks. Skills you should practice. You should practice skills. And first, you should practice using your friends, neighbors. If you're at home, your brothers, sisters, relatives, skills. And only after that, you can try to examine real patients. Because without skills, it's just, I give you bicycle, you will never ride bicycle and tell you, okay, read textbook and then immediately write. What happens? You fall down. You should train to do something. That's why actually, even we have a lot of sophisticated methods of examination, we still need actually old methods like palpation, percussion, auscultation, and so on. Next diagnostic technique. Of course, we can't live without laboratory and instrumental methods of examination now. Modern medicine needs, of course, analysis, as we talk, analysis of everything, analysis of blood, of urine, of no, you check COVID-19. What you do with your patient? Send to check COVID-19. How? You can use PCR reaction, polymerase chain reaction. You use swab from patient's nose and mouth. Use special, very expensive device, and this device search for particles of virus, polymerase chain reaction, and giving you some answer, COVID-19 positive or negative. Or you can check patient's blood, searching for antibodies, because our immune system reacting produced at first time at the beginning immune globulins M, then immune globulins G, and you can, using modern methods, detect these antibodies in patients' blood. Now, this is tests which need few seconds. Now you need patient's blood, drop into special plate, and after a few seconds, you see positive or negative. Yeah? This is laboratory examination. Many disorders can be actually confirmed without laboratory investigations. For example, diabetes mellitus. Everyone knows about diabetes mellitus. What is diabetes mellitus? This is chronic hyperglycemia. So this is chronic elevation of sugar levels in patient's blood. But to prove this, we should examine patient's blood. You can't get this guy from diabetes without checking his blood. Whatever happened, at least patient for general test of blood, general test of urine, sugar levels, cholesterol levels, creatinine level, checking his kidney functioning. So, and we'll teach you how to interpretate. We don't care how to do this investigation. This is special devices or laboratory staff do all these investigations. You as a doctors should know how to interpret results of analysis. And you should know that if sugar level, fasting glucose more than 6.1 millimole per liter, this is diabetes mellitus. And if it's in range 3.3, 5.5 millimole per liter, this is normal, no diabetes mellitus. This is laboratory investigations. Laboratory investigations. Next, instrumental. Of course, now again in all clinics we have a lot of devices. We have just X-ray devices. We have computer tomography, MRI tomography, fibroscopy, ultrasound examinations. A lot of different devices, imaging devices, helping us to understand what happened with patients. Now, of course, if you expect that patients suffer from pneumonia, you can't try this diagnosis without X-ray examination. Only X-ray can confirm or exclude pneumonia. COVID-19 pneumonia, just plant radiography may fail, and in case of again COVID-19 need computer tomography already. Computer tomography, which can confirm presence of COVID-19 pneumonia. Very popular ultrasound examinations because it's not pain, benign, and we have an ultrasound of the heart, ultrasound of liver, kidneys, all inner organs may be examined by ultrasound or with the help of ultrasound. We have ECG. And ECG, simple method, but still very important for diagnosing of cardiological problems. If you expect a myocardial infarction, you need ECG. If you expect some problems with heart rhythm, you need ECG. And actually, you will have classes about ECG, and you will be able to find simple diagnosis like myocardial infarction, atrial fibrillation, blockage of his bundle blockage, or something like this. You already, after our course, you will be able to find very common and very serious diagnosis, cardiovascular problems. Now you have actually separate disciplines like actually X-ray examination, and they also will teach you how to interpret results of this kind of examination. Okay, this is all about diagnostic technique. But question, what for we examine patient? What for? What we'll try to out? Methods of examination, all methods of examination. We search for signs of disorders. Because disorders, how we can detect disorders? We should find signs of disorders. And second part of diagnostics, this is study of the diagnostic value of symptoms of the disease. symptoms of the disease, symptoms or signs of disorders. This is known as semiology, because in Greek, semion, this is symptom or symptomatology. Semiology or symptomatology. This is study of symptoms of disorders. And again, already I told you about actually complaints. And complaints can reveal signs of disorders. For example, what is it? Pain. No, this is symptom of disease, symptom pain, or coughing symptom, or fever symptom, or actually, I don't know, actually fainting, also symptom. So all you can find examining patient, this is maybe symptoms of disorders. I told you about physical examination, heart murmurs, symptoms, some pain in actually right hypochondrium, also symptom. So all signs you find which can tell you about disorders, we consider symptoms. Again, sound very easy. Let's find some problems, and this is already symptoms. But it's again, by the way, symptoms is not only results of talking or physical examination. For example, symptoms also symptom. But in some cases, you should know that this is symptom, because people out of medicine, they don't realize that this is symptom. Oh, very simple. Let's give you a simple example. You have a patient. Patient complain of some chest pain. And as I told you, you ask your patient, please show me where is the pain. Show me where is the pain. And patient do following. He used his hand to show you, right? But he do strange movement. He clench his wrist and show you middle part of the chest. Clench and show middle part of the chest, like here. No, actually, if you are not a doctor, what you can tell? No, patient has some pain, retrosternal pain, and what? But as a doctor, you should know, even from the first lecture, you should start remembering some for all your practice, for all your long doctor's life. There are some ideas, some knowledges you should pick up and remember for all your life. And if you see patient, you should know that this is so-called Levine's sign. You know that many signs named by those names who and such who discovered such signs. What does it mean, Levine's sign? Levine's sign, when the patient do this, showing you where is the pain. And this is very important sign to detect angina pectoris, serious disease. You know about ischemic heart disease, you know about atherosclerotic plaques and coronary arteries, which cause deficiency of oxygen and nutrition for cardiac muscle. Clinically, it's presented as angina pectoris. Why patient do this? Patient know nothing about angina, about cardiology, but in case of angina, usually pain has specific character. This is so-called pressing pain. This is pressing pain, stabbing pain. Patient feel like something squeeze his heart, squeezing pain, something squeeze his heart, burning pain. And he just involuntarily try to show you that something squeeze my heart, help me. And if you see this, 95, 99% that this is angina pectoris. One sign, if you know about this, you can prove that this is angina pectoris. Of course, never rely on one side. Of course, you will examine this patient in future. You will do actually ECG, if it's need, you do coronarography, very sophisticated methods. You will find where is this. But before this, you find this Levine's sign to understand. And we have a lot of such signs. Some signs should be checked, so-called. We should usually term check the sign. Now, for example, you have patient with abdominal pain. Usually surgeons, they have patients with abdominal pain because acute abdominal pain, this is surgical problem in most of cases. And surgeons, they like to check so-called Blumberg sign, or in Russia, we talk about Schotten-Blumberg sign. This sign is very simple again. In the site of pain, surgeon first gently press and then suddenly remove his hand. Gently press and remove. And surgeon asks, where is more painful, when I press or when I remove? And if patient tell that when you remove, it's very painful, sometimes patients even cry when surgeon remove his hand. This is very serious sign. This is so-called peritoneal sign. Peritoneal sign. It tells that patient has peritoneal involvement into inflammatory process, peritonitis. The peritonitis. Peritonitis, it means that, for example, patients suffer from actually appendicitis, and inflammation from appendix already spread, already occupy peritoneum. Without treatment, peritonitis can kill patient in few days. That's why this peritoneal sign, so-called sign of peritoneal irritation, раздражение брюшины, peritoneum. Very serious sign telling that this patient should be examined, maybe even operated, surgically in his abdomen. And number of such signs enormous. I have a text, I have a book in my library, 2,500 symptoms or syndromes. Just imagine. Of course, no one can remember all these 2,500 signs because many of them are very rare, used by some specialists in nephrology, ophthalmology. But nevertheless, a lot of signs, and the most common used, of course, you should know. You will study all these signs when you study actually cardiology and endocrinology. Also, we divide signs into non-specific and specific signs. Non-specific, specific. What with non-specific sign? No, for example, fever. Patient complain of fever. No, this is very important sign. Very important sign. But this sign may present thousands of disorders. All infectious disorders presented with, most of infectious disorders presented with fever. Some non-infectious disorders like, I don't know, myocardial infarction also may be presented with fever. Or even pyrotoxicosis, sometimes rise of temperature happens. That's why important sign, but based on this sign, you can't find diagnosis. This is non-specific sign. We don't know what is COVID-19 or flu, just knowing specific signs will give you more ideas about possible problem. For example, I told you pain in upper abdomen, already stomach, maybe pancreas, all number of disorders becomes much more less, and you can actually find out better what have happened with patient if you have specific signs. Also, we use some pathognomic signs. Pathognomic signs. Find sign, meaning what? If you find this, 9% chance in giant pectoris. But unfortunately, we don't have pathognomic signs for all disorders. It will be much to find proper diagnosis presented. Unfortunately, no. Okay, this is all about science. This is all about science. Okay, next. This is so-called diagnostic methods or study of special ways of pondering aimed at identification of the disease. Okay, it's possible to say much more easier. You examine patients, you find some signs, And finally, what you should do? Find proper diagnose, name the disease. No sound, but no, it's easy. I gave you examples. Okay, let's discuss one patient. Patient, man, 55 years old. What have happened? 3 hours ago, he felt abdominal pain, pain in upper abdomen, in epigastrial region. Pain increased. No patient believed I ate something wrong, no, and did nothing. But after some time, patient felt nausea and vomiting. So now he suffered from actually pain, nausea, vomiting. And then he found out, he saw blood in his vomiting mass. He afraid, of course, because blood in all cases, this is something wrong. So we have man, 55 years old, with pain rather severe, not mild, rather severe pain, who are vomiting and who are vomiting up blood. Your ambulance doctor arrived to his flat. What do you think? What have happened with patient? What possible diagnosis we may expect? Who can reply? Ideas. What may happen with the patient? Pain in blood. What have happened? I told sometimes during lecture, I may ask you to reply. What do you think? Give ideas.
It might be ulcer.
Yes, correct. It with bleeding. So what may happen? Peptic did not ulcer because sometimes ulcer presented suddenly, presented with bleeding. No, all signs tell us about peptic ulcer. So peptic ulcer with bleeding. Okay, what we should do? We collect this patient, pick up this patient, and transport this patient to surgical department because complicated peptic ulcers treated in surgical department. Okay, surgeon on duty, examine patient. No, okay, no pain, no vomiting, blood. Let's do fibrogastroscopy because if you expect something in the stomach, now we have very good method. Fibrogastroscopy, special device, rich stomach, and with huge magnification can examine all walls of the stomach. Okay, doctor find out no big peptic ulcer, but we have erosions. Erosions, this is small defects of mucosal layer, and these erosions slit a little bit, actually bleeding. No ulcer, it means that no need in some urgent surgery. In such cases, if it's so-called erosive gastritis, erosive gastritis, it's enough to give some medication, patient recovers soon. Doctor, surgeon prescribe proper medications, send patient to the ward. He let this patient stay in the hospital. And then happened what? 3 hours later, patient died. What have happened? It's impossible to die from erosive gastritis. It's impossible to die from erosive gastritis. What was the patient death cause? Patient died from acute myocardial infarction. How it's possible? We just discussed Levine's sign that in case of myocardial infarction, pain should be retrosternal, somewhere in the middle of the chest, burning, stabbing, pressing, irradiated to the left arm. We know all signs of myocardial infarction. But again, next tip you should remember for all your doctor's life. We have so-called abdominal form of myocardial infarction. You know that heart placed on diaphragm. And if myocardial infarction happens in the base of the heart here, pain goes down, pain goes down to abdomen, and patient may feel severe upper abdominal pain, severe upper abdominal pain. You may ask, why nausea, vomiting? Nothing wrong with stomach in case of myocardial infarction. This is reflex. You know, our organism reflexes, and one of reflex, if you have abdominal, our body, our brain believe that something wrong with stomach, gastrointestinal system. And what may happen with stomach? Maybe you add something wrong. That's why you have stomach pain. If you add something wrong, what our body try to do? Remove this wrong from your stomach, causing nausea and vomiting. Why blood appear? Because in myocardial infarction, this is big stress for our body. And we have so-called stress ulcers. In case of myocardial infarctions, in case of severe surgery, sometimes we see erosions in the stomach, which may bleed. What was the problem? We did everything well. We examined patient, we find his complaints, but we finally failed to find proper diagnosis, and patient died. And this is real history, and this is not actually textbook. Unfortunately, it's happened. Problem was that different disorders may present with absolutely the same signs. They may present with the same signs. You may ask, and what to do, how to differentiate? Do following. If you know why I told you 55 years old man, because 55 years old man may suffer from myocardial infarction. If it was 20 years old girl, no chance, no myocardial infarctions in 20 years old girl. But if you have adult man, don't forget sudden, unexplained to do ECG, just simple ECG. And on ECG, you can find signs of myocardial. Surgeon should just ask help of therapeutist. And therapeutists examining this patient. Of course, therapeutists more clever. They have more knowledges. They can't cut something, but they have enormous knowledges about disorders. Therapeutists should tell, okay, let's do ECG and let's do laboratory investigations. For example, troponin level. Troponins, this is special proteins which may be found in blood in case of myocardial infarction. And if they did this, they was able to save patient life, because now in case of myocardial infarction, we can do procedure known as balloon angioplasty. Because again, infarction, this is thromb in actually coronary artery, which completely block this artery. Now we have devices, X-ray and special probes, which can reach coronary arteries, remove this thrombi and insert so-called stent. Stent is a small tube which don't let coronary artery to squeeze, and patient recover. If you do this in proper time, few hours, so-called gold hours, after beginning of myocardial infarction, patient recover completely, because heart can survive a few hours, heart muscle, even without oxygen, without proper blood supply. If you restore blood supply, patient recover, and we prevent patient death, we prevent myocardial infarction. Now, case enormous again. Not so, it's again, it's possible to learn by heart signs, symptoms, but it's difficult to learn because sometimes we told about diagnostic methods as doctors thinking, how doctors should think to find proper diagnosis, but how it's possible to actually to teach how to think. Only practice. And that's why experienced doctor, we have experienced doctor, we have no unexperienced doctor. What is the difference? Experienced doctor have experience. And in future, you will find such situation. You are a young doctor and you examine patient with senior doctor, doctor with big experience. You examine the same patient. You're talking with this patient, you see the same things, you see the same laboratory tests. and you think and tell, unfortunately, I don't know what have happened. I can't understand what happened with this patient. Senior doctor may tell you, you know, 5 years ago, I examined the patient with the same complaints. We also didn't know what had happened, but finally we found out that it was this diagnosis. Why senior doctor find this? Because he has experience. And that's why to be a good doctor, you should practice many, many years to be able to find proper diagnosis. Of course, in most of cases, we talk about simple disorders, when even unexperienced doctor, if he knows some ideas about methods of examination, able to actually find proper diagnosis. You know, my international told me that after a year after Propaedeutics, his relatives who are working as a doctors, them practice, participate in actual examination of patients. And student was very proud. He told me, you know, I was able to find out proper diagnosis in 75% of cases. Again, in simple cases, it's rarely easy to find diagnosis, but in so-called complicated cases, you need big experience. No, that's why never hesitate to ask help of senior doctor. Never hesitate and never actually never deny if you are experienced doctor, you must help other doctors in diagnosing. That's why you know about consilium. Consilium, when one doctor can't understand what have happened, ask help of other doctors, and they together examining patients, thinking how they can help. You know, actually, I told you we have 20,000 disorders. No one can remember, but everyone now has a computer, smartphone, computer. Computer can remember millions of disorders. What is the big deal? Let's do simple thing. Let's write special program. Signs and disorders. And you just click, fever, temperature, fever, coughing, changes in blood, and computer should give you proper diagnosis. Why don't do this? We have programs for everything, but we don't have. Unfortunately, it does. Actually, such programs exist. I remember Dinosaurus, something like this. One of programs known as Dinosaurus. It's in English spelling, and usually this is for students, not for doctors. Because you know what happens? You spend a lot of time to click, and then what happens? Computer give you 100 possible diagnoses. Because, again, number of disorders much more than number of symptoms. Many conditions, many signs, if it's impossible to fix, it's like actually you doctor, experienced doctor already, involuntary by his mind can pick something, signs which he even don't understand, but in his mind is working and given some possible ideas. That's why don't worry, computer can't work instead of you, I think many years. For imaging, by the way, for example, for X-ray examination, now already computer programs in some cases, for example, searching for cancer, you have X-ray and radiologists search for cancer. In some programs already do this better than doctors even. But this is imaging. This is what possible to actually examine using formulas, using imaging programs. If you deal with real patients, it doesn't work. That's why. What else create problems for prognosing? You know, when you start working with real patients, with peptic ulcer disease, and start talking with him, and you suddenly find out that patient tell you something wrong. In peptic ulcer, pain should be happened after meals, but patient tell you, you know, I have pain without meals, before meals, after meals. I don't even know what caused my pain, how it's possible. It's wrong patient. in textbooks, you have some, I can say, summarizing complaints of patients. Something, what happened in most cases with high probability, because each patient is unique and each patient may present disorder absolutely different. We talk about atypical disorders. What means atypical? Because we have typical what's in textbook and atypical what's in real life. And it's happened in many cases. The disorders presented not like in textbook. So this is another challenge. So what I try to tell you that it's impossible to teach how to think. It's just practice. You practice, you see patients, you examine patients, you have talk with senior doctors, you have some actually ideas in your mind. That's why diagnosing is very, very difficult subject. Diagnosing is very difficult subject. It's a very bad patient death. In one example, previously we had a lot of Malaysians, and I visited Malaysia many times, meeting with our graduates. And one of our graduates, he's working as a forensic medicine specialist. Forensic medicine specialists, they examining bodies of their patients and trying to understand what happened. And he told me one story. He just was busy and was late for meeting. Why? Because they discussed in the clinic one story. Women, 30 years old, visited office of general practitioner. Complaints, some abdominal pain, some weakness, some abdominal pain. I don't know how this doctor examined this lady, but he writes in case history, just dyspepsia. Dyspepsia, very common symptom. Everyone suffers from dyspepsia. Add something wrong, just go home, take some pills, and everything will be okay. No, you already suspect what happened. These women come back home and died. What was the reason? Reason was severe internal bleeding. Severe internal bleeding. What was the cause? Rupture of ovarial tube. Rupture of ovarial, or this is so-called ovarial pregnancy. Ovarial pregnancy. One pregnancy developed, but ovarial. What was the problem of the doctor? Again, remember for all your future doctor's life, if middle-aged or even young women complain of some abdominal pain, you should ask very simple question. When was the last menses? Because if women tell you about some delay of menses, this is maybe very serious, because what happens? Ovarial pregnancy, when it starts growing, fetus start growing, cause rupture of tube and cause severe bleeding. Again, if women tell you about delay in menses and she suffer from some abdominal pain, especially low abdominal pain, immediately send her to gynecologist to be examined by ultrasound to search for blood in abdominal cavity. If everything done in time, okay, this is simple surgery, stop bleeding, and that's all. If you don't do this, patient dies. And I can give you a lot of such examples. One mistake, patient death. Medicine is very serious. It's really very serious. I don't understand how it's possible to study medicine and to have satisfaction or fail on exams in internal medicine. What are you going to do in the future? Or missed classes, or missed talks. This is patient death is in the future. Patient death in the future. That's why be very careful with studies of real medical subjects. You can say, okay, chemistry, what for I need to learn chemistry? I forget some formulas. No, chemistry maybe. If you forgot what is mean Krebs cycle, no, your patients will never suffer. But if you forgot about actually Levine sign, your patient will suffer a lot. Okay. I think this is what I want to tell you about medicine, about our disciplines. Actually, on your regular classes, you will study how to examine patient, what does it mean case history, anamnesis morbi, anamnesis vitae, examination of patients, and so on. Right now, you should remember that medicine is a very difficult, but very interesting and very important discipline. Okay, if you have questions, you may ask me. What about questions?
No, sir, I don't have.
Okay, if no questions, good luck. We're waiting for you in our department, you know, областная больница, да, building number, have mask, second, you should follow all recommendations to prevent COVID-19. No, you know about all this stuff. Okay, if no questions, good luck and see you next week. Bye.
Thank you, sir.
Thank you,
Thank
sir.
you, sir.